Good morning everyone. I am Dr. Rakhi Mohan. I am a gynecologist at Ikshana Multispeciality clinic. This month is a fibroid awareness month, and this is the best time to talk about a tumor which is so common and yet so benign in nature. So fibroid is a fibromuscular tumor which is diagnosed primarily in the third and the fourth decades, that is in the 30s and the 40s of a women. Fibroid is a hyperestrogenic tumor which tends to grow mostly in the reproductive age group. And once a woman attains menopause, it has a tendency to come down on its own. Fibroid is a very common tumor. It presents with pain, and many a times it presents with heavy bleeding, irregular bleeding. There are many types of fibroids. Most common fibroid is an intramural fibroid which is present in the muscles of the uterus. Then there are other varieties of fibroids like submucosal fibroid, intramural fibroid and a subserosal fibroid. The submucosal fibroid is the most notorious one in causing symptoms like heavy bleeding. As it is present inside the endometrial cavity, it distorts the endometrial cavity, making it increased in size and therefore presents with heavy bleeding. Intramural fibroid is mostly present in the muscles of the uterus, and when it is large in size, patient may present with pain and sometimes heavy bleeding. Then the subserosal fibroid, which is mostly present on the outer layer of the uterus. Sometimes this fibroid presents with a stalk, and then it is known as a pedunculated fibroid. If it is large in size, then it can cause a lot of symptoms by undergoing torsion. That is why it is very, very important. Early diagnosis always leads to complete treatment. Whenever any women presents with pain in the lower abdomen, a series of investigations are done to rule out fibroids. So the most important test to rule out a fibroid is ultrasound of the fibroid. In the ultrasound, we are able to know the location of the fibroid, the size of the fibroid. If the fibroid is small in size, if it is less than 5 centimeters and the patient does not have any symptoms, it can be treated medically. If the fibroid is bigger in size, if it is between 5 and 10 centimeters and the patient has symptoms like pain and heavy bleeding, then it can be treated either medically, surgically. In surgically, people who are younger and who are facing issues of infertility because of presence of fibroid, it can be dealt with laparoscopically. The procedure which is known as myomectomy, in which we remove the fibroid laparoscopically, and the chances of the women to conceive after the procedure are very, very high. If the fibroid is more than 10 centimeters, it is a large fibroid and it needs removal. So mostly it is the women in the reproductive age group who present with fibroid. If you have any pain in the lower abdomen, kindly meet your gynecologist and get the right treatment done. It is a treatable condition and an easily treatable condition. So in this Fibroid Awareness Month, our message to all the women is to be aware of your symptoms and to meet your gynecologist as soon as possible. Thank you so much.